So another aspect of work that you do is working with doctors and allied health professionals. Can you tell us a little bit about some of the projects you've been working on and how that work's continuing after the peak of the pandemic?
Yeah, so I was asked to be involved with a charity called Doctors in Distress in the early days of the pandemic, offering online groups for doctors who'd been affected by COVID, and in particular long COVID. And I ran some groups for doctors, GPs, and also hospital doctors, and that extended to working with allied health professionals, nurses, paramedics, physiotherapists, all who've been affected by the pandemic in some way. And now that the main pandemic is over, some of those doctors and allied health professionals still want to continue in therapy, partly because they don't get much support in their workplace. They may get management supervision and clinical supervision, but their own well-being is always put to one side because they always have to put their patients first, which is understandable. But I think they get so identified with their role that it's very hard to get support for themselves, and that's really important. So I still provide both individual and group therapy for people in the NHS. And I also have the NHS refer to me for staff who are struggling.
Yeah. So that's sort of something that we would imagine would go on for quite a while. You know, the NHS is still under a lot of pressure, and sort of those stresses and strains are still there, aren't they, for the staff that are working there still?
Well, I think it's getting worse at the moment, really, because they're under a lot of strain because people have left, people have retired during the pandemic, and they can't get replacements. So those that are working still in the NHS are having to take on a lot more load than they would have prior to the pandemic, and that stresses people, and they need support.
Yeah.
And it's helpful for them to get the support outside of the place where they're working.
Yes.
So that they have some sense of anonymity and confidentiality.
Yeah, away from their working sort of environment. And is some of that done in a group situation with doctors, did you say?
Yeah, I have some doctors in my therapy groups. They're from all over the UK, and I also see some individually.